Thank you for joining us today for our Survivorship special topic in February. My name is Julie Lanford, and I'm the Wellness Director at Cancer Services. We are a cancer support nonprofit located in Winston-Salem, North Carolina. And each month, Cancer Services posts a special topic video with experts in a variety of areas relating to cancer survivorship and caregiving. And these videos are posted on Cancer Services website and our YouTube channel. And the audio is also available on our podcast, The Triad Cancer Connection. All survivors and caregivers are invited to join us for our Survivorship Special Topic Discussion Group, which will be on the fourth Tuesday of every month. So this month, that's on Tuesday, February 28th, the last day of the month. You can choose to join us at either 1 p.m. in person at our office on Maplewood Avenue or 7 p.m. on Zoom. We just ask that you register so that we know to expect you. You can go to cancerservicesonline.org/register to sign up for our special topic discussion. You don't have to specify whether you're coming in person or on Zoom. If you don't show up at 1 in our office, we'll know to expect you online that evening. So today's special topic is socializing when you're immune compromised. And our expert speaker today is Dr. Stacy Wentworth, the Medical Director of Survivorship at Atrium Health Wake Forest Baptist Comprehensive Cancer Center. Welcome, Stacy. Thanks so much for being here.
Hi, Julie. It's good to see you. Thank you for having me.
So, okay, we decided to do this topic because, well, first of all, it's very relevant for our current time. Respiratory illnesses are always higher in the winter, and here we are. People facing cancer can be immune compromised. So in addition, we had this topic kind of expired by a client of ours who was wanting to make sure that she was, taking advantage of the opportunities, but also playing it safe and being smart. So we do offer plenty of virtual sessions, but we did want to kind of do an update on this topic. And Dr. Wentworth was kind of joking about how we've done this multiple times over the last few years, and we're like, here we are doing this again. I can't believe we're doing this again, but this is what we have.
Yes. Yep. It is a constantly changing situation. That's for sure. I'm very glad to be diving back into this because I think it's something that I tend to look at every couple of months, sort of where am I and what's going on. Thankfully, it's not a complete hold on our lives like it was 3 years ago, but especially for patients, I'm getting this question a lot more. So I think this is a great topic. I'm excited to be here. Thanks.
Yeah. And, I think we've all kind of learned specifically through the pandemic, like maybe some of us were like, oh, great, I can just stay at home and be with myself and my family, and I'm all good with that. And then you realize, oh, okay, physically being together brings something different in a sense of connection. And so, and going through cancer can be very lonely, and you need that extra connection. But then being together with other people adds extra risk of exposure. So we thought we'd do kind of a catch up. So first of all, can you catch us up? What are the current trends or updates when it comes to COVID and other illnesses that are going around right now?
Sure. So I will first direct people to Dr. Chris Ohl is our infectious disease specialist at Atrium Health Wake Forest Baptist, and he does a Facebook Live. It's also available on our YouTube channel, and it usually lasts about 25-30 minutes. And if you ever want to just dip your toe in, I really enjoy watching him, and I learn a lot from him just on a weekly basis. So I would first direct, if you want to sort of dive in deep into this, then going back and listening to Dr. Ohl, I would give you that resource. The current trend, sort of where we're at, so we have a new variant. It's called XBB 1.5. It does appear to be more infectious, and it appears that it has developed the ability to stick at the back of our nasal and oropharyngeal mucosa. So it does look like, however, that we continue to have this decoupling or this separation between infection and mortality. And because of all the trauma related to 3 years ago, that's really hard to comprehend. But we do see infections going up, but mortality is still down to about 90%. And we think that's mostly due to natural and vaccine provided immunity. So wastewater numbers are going up. We're at about 18% positivity, 18-20% positivity.
So wastewater, for people who
Yeah.
maybe aren't familiar,
Oh,
they
sorry.
developed a way to kind of like evaluate the amount of infection going around by testing wastewater.
Correct. As more people,
City, I guess. Only cities would do this.
correct. Yeah, no, you should not test your own wastewater. That is not CDC.
If you have a well, just don't worry about it.
So yeah, once we started doing more at-home testing, that percent positivity that we were making a lot of our decisions based on became less relevant because a lot of that is not getting reported publicly. So wastewater is a way people are literally pooping COVID, as Dr. Ohl says. That is a way for us to sort of think about how prevalent COVID is in the population. So that's how public health experts are monitoring the prevalence of COVID. And so that those numbers are going up and our hospitalizations are going up slightly, but nothing like the slopes of the curve where we're just seeing massive hospitalizations like we did with Delta and we did with Omicron. So hospitalizations are slightly increasing, but again, we're not seeing those huge numbers and those massive spikes like we were all seeing before that were kind of scary.
Okay, that's helpful. So also interestingly, I think, is understanding what is the chance that a person who's like, I don't think I ever have had COVID, actually did have COVID at some point.
Yeah, so I will speak a little bit about that. So this was pre-Omicron. It was a study out of Johns Hopkins, and they looked at, like, I don't think that I have had COVID. And this study looked at people that did not have a positive infection and did not had major symptoms. And they looked at the spike antibody. And the spike antibody, the antibody is something that our bodies produce that tells us whether we've been exposed or not to the spike protein. And that prevalence in the population was about 95%. And that says that people had either been vaccinated, which developed an antibody to recognize the spike protein, or they had been exposed to the spike protein by natural infection. So that is about 95% of us have developed antibodies to that spike protein, which is wonderful, way different than where we were 3 years ago. If you look at people who test positive for the sort of nucleocapsid or the inside of the virus, which can only be found with natural infection, that's about 86% in children and about 70% in adults. Probably a little bit higher after Omicron, but overall, about 95% of people have evidence of immunity to the spike protein or to COVID in general. And it looks like the majority of people, again, somewhere in the neighborhood of 70 to 80% of people have been infected, possibly with asymptomatic infection due to Omicron. So overall, our population is developing immunity, and we're seeing that again because we're not seeing as many hospitalizations, although we are seeing a rise in prevalence and infections.
Okay. So for our audience of cancer patients and survivors and those who are sort of in their circle who would, potentially expose them to things, who are the clients who should be the most cautious in regards to being in public places?
Right. So I put people, there are a lot of respiratory viruses going around. Flu peaked early this year. So November, December, usually flu is starting to peak now. So we had an early flu peak. There's a lot of rhinovirus or the common cold around. There was a lot of RSV in children. That's sort of declining. So there are just a lot of respiratory viruses. And I think that none of us want to be sick. So a lot of this has to balance hospitalization risk, feeling bad, missing work, missing out on things that we want to do, and protecting our older people or our people that are at risk. So the The people that seem to be at risk for hospitalization from flu, which is still around, from COVID, and from RSV or rhinovirus is people with low white blood cell count. This can be people that are getting pretty significant doses of chemotherapy, and your doctor would have told you your white count is low, we're holding your chemotherapy because of your white count. Other people that are being treated for things like leukemias, lymphomas, including patients that have a CLL or other diseases of the blood, those patients are thought to not mount a good immune response to infections. Certainly anyone who has had a bone marrow transplant or is on immunosuppression for other things. People that have had a kidney, a heart, a liver transplant are on treatment for multiple sclerosis, for rheumatoid arthritis, for lupus, who are on any sort of immunosuppressive medications, high doses of steroids, for example. Those are all the low white blood cell count due to active chemotherapy, any treatment for a blood disease like a leukemia or lymphoma, and any patients that have had transplant or are on chronic immunosuppressant, for example, anti-rejection medications after a solid organ transplant, or on treatments for other immune modulated diseases like rheumatoid arthritis. So those are really our high-risk cancer patients. In addition to, again, anybody over 65, that seems to be the cutoff point for hospitalization and for higher risk patients.
Okay, so let's say somebody who has breast cancer and isn't doing chemotherapy, what would their kind of risk be? General public, more dependent on their age and other medical factors?
Correct. Yeah, it seems like the patients that are at higher risk and who need to be vax boosted and double boosted are patients that have greater than 5 comorbidities, are older than 65, patients that have significant immunosuppression, or patients that have renal failure. That was a study that just came out a few weeks ago. And so if you don't fit any of those categories, that means significant risk for hospitalizations. If you don't fit in those categories, you still could be at risk for feeling bad, for needing IV fluids, but are not at super high risk for hospitalization.
Okay, so, and then I think that also brings me a little bit to the question about testing. So that you know if you do get sick. So let's say you're feeling like, okay, I'll be a little cautious, but I'm going to go out there and socialize and take on a little more risk than maybe somebody else. If you do get sick, you're feeling sore throat, stuffy nose, or whatever, at what point do you need to test yourself? Because there's some good medications, but there's a timeline on this, right?
Right. Yeah. So I think anytime we're thinking about risk, you're thinking about hospitalization, feeling bad, and then being a good citizen and not wanting to give it to somebody who could be more high risk than you. So anytime you're making a decision, I think looking at those 3 buckets is important. Am I at high risk for hospitalization due to a respiratory virus? Am I immunocompromised myself? And am I, do I want to not miss work and just be sick? And do I just want to be a good citizen? So the testing that we're doing now is really a test to treat. If you have a stuffy nose and a sore throat, I think that there are free at-home tests that are still available. And if you are COVID negative and you had no fever, you probably just have the common cold. So retest for COVID in 48 hours and stay at home just to be a good symptom, because nobody else wants your upper respiratory yuck, and stay home until your symptoms improve. If you retest and you're negative, if you retest you're negative and you have a fever, you might have the flu. And that's when you need to call your provider, because you might be a candidate for getting Tamiflu, which can decrease the severity and the length of time for flu illness. If you are COVID positive, should stay out of work, work from home, stay away from people. And if you're over 65, or if you have underlying health conditions, which cancer could be considered one of those, you should call your doctor and you can get a script for an anti-COVID medication. We can talk a little bit about those medications if you want, some of the pros and cons of those, but really we're testing to figure out, should we stay away from high-risk people that are in our population, and am I a candidate for treatment? So that's sort of the reason to test.
And the time frame for treatment, because I think I've known people who, like, they felt bad and then they felt bad for a couple days and then they started to feel worse and they felt really bad. So then they tested themselves, but their doctors were like, no, you missed it.
Yes. Yeah. It's kind of annoying. So the Paxlovid, which is really the most effective oral medication that we have right now, must be started within 5 days of symptoms. So if you feel a little bit of sore throat and a runny nose coming on, and I mean, we all kind of get a little bit of that during the winter at some point, but if it's getting worse on day 2 or 3, you need to test, and you can do a home test. And then you can also go in and do a test and treat. So those are available at local pharmacies. There are several, you can go to the North Carolina Department of Health and Human Services website that Julie can include in this presentation that sort of can localize those in your area. And they can test, and then you can see a nurse practitioner or PA and get treated for COVID. So
what about, because flu is kind of the same, right? For
Yep.
Tamiflu, there's a window as well.
Yep. Correct. Yeah.
Okay.
For the IV medication called remdesivir, it's harder to find because it does have to be given IV and it's 3 days. That's within 7 days of symptoms. It is coming out in oral form. There's some early data out of China that the oral medication is working better. The IV is better in some ways because it doesn't have some of the side effects. It doesn't have a lot of drug interference. It can be given within 7 days. The Paxlovid does have a bad taste, or patients can get some taste changes because of the Paxlovid. And there is also a rebound phenomenon where after you finished your Paxlovid, you can feel bad for a day. There's like a rebound infection with Paxlovid. So definitely for patients though, all of those are minimal side effects compared to, again, people over 65 and anybody really with high risk disease or with high risk factors, multiple comorbidities, diabetes, high blood pressure, renal failure, heart disease. If you're over 50 with a couple of those risk factors, you really do need to talk and think about being tested for treatment because it will decrease your risk of hospitalization, will decrease how long you feel bad, and it will also decrease your risk for long COVID. Some studies seem to indicate.
Okay. So it's like, all right, risk is now lower because we've got a lot more immunity going around and the disease itself tends to be less severe. And you should also have a plan. So if you start feeling like you have a cold, like everybody wants to say, oh, it's just a cold. Okay, whatever. If you feel like you have a cold, plan to test yourself for COVID. If you develop a fever, you probably also want to test yourself for flu. Kind of don't wait too long and make sure you have a doctor you know to call. Because in these situations, for someone in treatment, would they call their oncologist for having a cold or symptoms of this?
Yeah,
Okay.
yes, I would say absolutely, because it could interfere. If you are under treatment, I would say definitely call your provider because it might interfere with your ability to receive chemotherapy or to receive radiation, or it might delay your surgery. And that's another reason to sort of be careful and to not want to be sick is you don't want to delay your chemotherapy. You don't want to delay your radiation. So in that situation, I definitely would contact your oncologist. If you are out from treatment and you're just in survivorship or in medical follow-up, then I would call your primary care physician. Or if that's hard to get into or you don't have a primary care physician, that's okay. There are the Minute Clinic at CVS's or Walgreens that have been set up for the specific situation is test and treat for COVID and flu.
Okay, perfect. All right. And so we've talked about low counts. So that would be a time where people want to be extra cautious, right? And if you're not sure what your counts are and you're somebody who's in treatment and getting regular, lab testing, you should be able to ask any of your providers, how's my white blood cell count?
Yep.
and they will be able to look it up and tell you, and you can talk with them about, your risk for infection.
Yep. If you just received radiation or you just received surgery, it's likely that your immune system is unaffected by your cancer treatment. And then you're just in normal precautions based on your other risk factors and comorbidities. Chemotherapy, just like you're saying, Julie, check with your doctor and see if your white blood cell count is low. And again, you might want to talk with your healthcare team if you have had a lung cancer, or how is your lung function? Did you have lung surgery? Could you recover from a pneumonia? Again, these are respiratory symptoms, just like a pneumonia or just like a bronchitis. So sometimes it's related, it's sort of rarely related to your cancer, except for the treatment with chemotherapy and the white blood cell count. But a lot of it is driven by the patient and your individual risk factors, like your age and your other medical problems.
Okay. And then also who you might be around. So the reasons that even if you're somebody who's just doing surgery or just doing radiation, but you're going into the waiting room and there's other people in the waiting room that are in chemo, that's why we all still wear masks there. We all wear masks in the situations where we're going to be around other people that might be immune compromised, because you might bring something in that could be harder on them than it is on you. So that kind of brings me to the next question, I think, which is, what is the latest on masks? So like, I know at the hospitals and most medical clinics, we're still asking people to wear masks because we know we have immune compromised people coming in, but like, what's the latest, like going to the grocery store or going to, a class or the movies or church or whatever, like what's the latest on masking for that?
Sure. Well, I am under 50 and don't have any comorbidities. So I trust my vaccine. So I personally am eating out at restaurants. I don't wear a mask to church. I don't wear a mask to grocery stores. I just feel very comfortable with my vaccine, that I am protected from severe illness and I don't have medical comorbidities. So that's sort of what I'm doing. I am not around other than in the hospital. I'm not around any immunocompromised or older people at home. What are you doing, Julie? What are you personally?
Kind of similar. I do have a family member that's nearby who is immune compromised, and so we keep that in mind, but we're not, and my kids aren't masking at school. Now, my husband, who's a little bit less on top of his booster stuff, like he's just slow at getting his flu shot, where I was like, the minute it's available, I'm getting it.
Yep.
So he got like a cold or whatever, who knows, and he masked around everybody. I mean, he masked around us in the house, he masked everywhere he went, because we don't like feeling sick.
Yes.
So I'm like, and we did when, it's the whole winter, like sometimes your nose is stuffy, you don't know what's going on. So when my kid had a stuffy nose one morning, we sent him to school with a mask because we're like, we don't know. It turns out he had nothing. So the next day he didn't. So we sort of just ride that.
Yep.
If we feel well, we don't mask. I do mask at work because we all do here in the office, because we don't know who's coming in. But that also makes me feel better because if I'm around people at work and I have a mask on, I feel better about, what I'm doing outside of work, if that makes sense. So I think a lot of us are just figuring out, balancing, like, who am I going to be around? And like my parents were supposed to come up for Christmas, but my dad was sick and we were like, no thanks, so they waited and came when he was well.
It's a lot of the behaviors that you're seeing for healthcare providers. We are trying to preserve the healthcare workforce as well, so that we can serve people. If everybody in healthcare gets sick, there's not going to be anybody to serve people who are sick as well. So a lot of the behaviors that you see healthcare providers are A, because we are around more immunocompromised people, and B, it's to preserve ourselves to be able to care for the public. So I do think the WHO recently, just today or yesterday, released that they are recommending masks on planes again. And I will say, and Dr. Oll, I learned this from Dr. Oll this week, The N95 is really where you need to be masking. So cloth masks with this new infectiousness of the new variant are not effective. So if you are going to mask, N95s are readily available, and wearing those properly is where you need to be. And I think if you are feeling sick, it's just like you're saying, like, there's childcare issues when kids are sick. There's when mom's sick or when dad's sick or when a family member is sick, especially an older family member, it can take them a while to recover. So I do think that one of the things we learned about with COVID is that maybe masking around people is just being a good citizen and not wanting other people to be sick, just like your husband did. So I kind of have used that, and it's easier in your own family to not like banish your husband or your partner to the other part of but just wear a mask when you're around us, because like you're saying, none of us want your germs. So I haven't traveled, but I do have some traveling coming up. I am going to wear an N95 on the plane. I am going to wear it in TSA when I'm around a lot of crowded people. I am going to wear it on and off airplanes. I have been to concerts. I've been to indoor events. If I see the wastewater numbers going up, I might consider masking at those places. That's again, because I'm an oncologist. And if I'm not available, that puts a strain on the rest of my apartments on my team to cover me. So that would be a decision I would make personally for my workplace, but I do think my vaccine is effective. I don't worry about going to dinner or restaurants or anything like that. But if I am going to be in a crowded place, especially when people are yelling or singing, I would consider putting on a mask or maybe not attending for me as a healthcare provider. I also think washing your hands can prevent a huge number of not COVID, but other viruses and cold and flu and all that kind of stuff that we tend to pass around in the winter.
Yeah, which I feel like when the pandemic started, it was like, wash your hands, wash your hands. And I was like, what? Have people not been washing their hands? Like, what? So yeah, it is a good reminder. And like having those, of course, when you go to the bathroom, but before and after you eat, like just having regular times that you're kind of like, oh, okay, yes, wash your hands and, keep masks handy. I've noticed since the rates, like the CDC has those, green, yellow, red for your county. And I've noticed, I think Forsyth County is just sort of currently in red. And I've noticed more businesses just kind of making a bigger point, or like a meeting that went virtual instead of being in person recently. So I think some people are paying attention to those things, and but everybody's sort of figuring out what is going to work for them.
I think that's important, because you don't know, that business may have somebody who's immunocompromised, who's getting treatment for rheumatoid arthritis. So I think a lot of this, our great grandchildren will be getting vaccinated for COVID. COVID is not going away. And I don't think that was the most helpful public health message, that we were going to get rid of COVID. It's with us. So now I do feel like it's just how can I be respectful for somebody else's thing that they might be dealing with? So if somebody else is wearing a mask, great. I don't know what they're getting treated for, or who they live with, or why they're at Target. So I think you have to kind of make your decision for where you're comfortable. But I can't not go to dinner with my friends anymore. Like, I just love that. Just like you were saying, Julie, we were missing out on so many things. I hang out with my kids and my goddaughters, and I go to concerts, and I'm planning some overseas travel. And we are not going to escape COVID by putting ourselves in houses. So I do think that there is figuring out that risk for yourself, which again, I'm young and relatively young and healthy. But I do know that, like, my parents my husband's parents who live in Kernersville, they are wearing masks, and they do go to the grocery store when it's not crowded, and they still go, but they are kind of making some adjustments based on their personal risk, because they're in their 80s. So, and I think that's totally fine. So it is a moving target, and nobody's doing anything right or wrong. It's just figuring out your own personal. I don't think you're going to see everybody moving together like we did probably in 2020. And you just have to kind of create space and grace that if somebody's in a meeting and wearing a mask, okay, I don't know what their deal is, or maybe they have a cold and they're doing it for me. So thank you.
Yeah. I feel like everywhere I go where there's like a grouping of people, there's at least one person
Yeah.
wearing a mask. Like there's always, for whatever reason, and sometimes it's me.
Yeah.
So,
oh, for sure. Yeah.
Okay. So the last thing I wanted to ask about is vaccines, because I'm just a little bit lost, I guess. I feel like, okay, so we had the 2-shot and then there was a booster, and then some people like immune compromised got another booster. So that was 4, and that was supposed to be all part of this quote primary series. And now there's this annual booster. Is that right?
Yeah. So
And a bivalent. Okay, that thing came out in the fall, and that was like a fancy booster.
yes. So basically, if you are normal, not like normal, what's normal? If you are without medical comorbidities, you're healthy and you're basically younger, I would say under 50, your 3 shots are okay with an annual booster. And that's sort of where we're going to be. It's going to be the flu shot. If that is what the US is doing, everybody gets an annual booster over 6 months, but we are the only country that's doing it. The bivalent booster, everyone should get. If you have not had a COVID shot since September, you should go and you're going to get the bivalent booster. And that's helpful. It's providing, again, that separation between hospitalizations and cases rising. That is because of the booster and because of natural immunity. So we have done what we want to do, which is everybody that gets COVID is not being hospitalized.
What if, so I know I got the bivalent, and I got
yes.
it, I don't know, end of September, early October. I can't remember. Of course, I forgot my vaccine card, so now I don't have a record of it. But I know I did it. And I just went to Paris Teeter, and it was really easy.
Yep.
And I actually got my flu shot at the same time because I felt like I just got to do these and get them done. I don't need another one. Is that right?
That's correct.
Until like whatever, next fall.
That's right. Yep.
And what if people didn't get the primary series?
They should start. This is a great time to do that, and it's never too late, and it is a good time to go ahead and start your primary series. Mm-hmm.
Okay. And then, so that's basically it. Annual booster. If you didn't have one since September, you should have the bivalent now.
Correct. Yep, that's correct. I will say, I mean, we can talk a little bit about side effects of booster or side effects of vaccines. I will say the flu vaccine this year was 100% effective. So they predicted, so putting a flu vaccine together is like, betting on a table in Vegas. You're trying to bet the future, and they bet and they predicted our flu. I mean, we did not have the overrun hospitals with flu that we have seen in the past, where there's no hospital beds available and people are flying all over trying to figure out where people were hospitalized with the flu. So we, our epidemiologists and our virologists are doing a great job with vaccines. There is no sudden death. There's no MI. There was nothing to do with the Buffalo Bills player that was hospitalized. That had nothing to do with vaccines. The heart side effects, which is a slight risk of an inflammation of the heart, is seen mostly in young men. And it is about somewhere in the neighborhood of about 40 out of 1 million people. And if you think about, I mean, you're more likely to get struck by lightning. So it is a very rare, you're much more likely to get in a car accident. You're much more likely to die in a plane crash. And we do those things.
Thanks for all this positive. Very uplifting.
So get your vaccine, but don't go in a car or a plane. So it is very, very rare. So, and most of those young people, their hearts have recovered from that. So there are some side effects for sure. I think the fever, flu-y, kind of feeling bad, that is your body ramping up, responding to the vaccine. That is real. That can be treated with anti-inflammatories. But by far and away, a very safe, very effective vaccine.
Awesome. And if you've had COVID, you have to wait a certain amount of time to get the booster, right?
Correct. Yeah, definitely after your symptoms are over. It's pretty rare that people are starting their primary series now, but especially as you're going into cancer treatment, I still have several patients that, had some hesitancy before or just didn't get around to it for whatever reason. If they're getting chemotherapy, again, that immunocompromised status, the low white blood cell counts that can happen with chemotherapy, I encourage them to talk to their oncologist about, should I start my COVID series now? Because again, young and healthy, you could tolerate a COVID infection before. The situation has changed now. If you're diagnosed with cancer, now we may be doing things to you that make your body less able to respond to COVID. So again, this isn't a one and done decision. Life changes, our bodies change, humans change, situations change. And so if you are a newly diagnosed patient who hasn't gotten your COVID vaccine, coordinating that with your doctor before you go on to get chemotherapy and talking to them about, do I have time to mount an immune response, might be a good idea, because we unfortunately are still seeing the majority of our patients who are being hospitalized are unvaccinated still.
That's a good tip. Okay, so what I'm hearing is, as we're starting to offer more socializing options and survivorship programs in person, in addition to our virtual ones, that generally, if your counts are good and we're all planning to mask, like it should be safe.
Mm-hmm. Yep. You're going to immunocompromised older patients and kind of read the room. I mean, just be a good human. We're not fighting the virus. We're just trying to live together as human beings and not blow virus all over each other. So if you do know that you're going to somebody you're going to grandma's house and you do have a snuffly nose, or you are going to a survivorship where you know that maybe you look around the room and you see there are some older patients, like take your cues from them. I've been in several groups where everyone's been asked to close their eyes and raise a thumb if they would like to wear masks. And if one person raises their thumb, then everybody wears a mask. If nobody does and everybody's comfortable, then fine. But it's sort of figuring out the least comfortable person that's in a higher risk group, and figuring out how to make that person feel safe, because the most important thing is for us to all be together. So that is really, really important. And I think survivorship groups like you guys are doing are safe for the majority of patients. Be careful if you're immunosuppressed, be careful if you have some comorbidities and you're older, be careful if you have a leukemia or lymphoma. But other than that, I really feel like the risks are outweigh the benefits.
Awesome. Okay. So I was planning to, thank you so much for all this great information, because it's super helpful. And I was going to ask you to share one piece of advice, although I'm not sure if you just shared your piece of advice because it sounded pretty good. But do you have any last thoughts to share with us today?
Well, I really like what you said about your husband, and that is the message that I'm getting from the public health experts, is read the room and be a good citizen. Just because I'm healthy, I trust my vaccines. We are not where we were 3 years ago. But if I've got a cold, or if I know I'm going to be around some higher risk, older or immunocompromised people, then I put a mask on. And that is not a big deal. And it's more just out of caring for them. And so I would that is what I am doing for myself. I'm not worried about being hospitalized myself. I'm not worried about dying of COVID because of my vaccines, but I do worry more about other people. So I think read the room and just try to be a good
human.
And be a good human. Yeah.
Okay, be a good human. Look, if you're sick, wear a mask or go virtual.
Yeah, do not come to work sick. I had to send somebody home last week about, what are you doing sniffling all over the place? Nobody wants your crud. What about you, Julie? Have you heard anything good, or do you have a thought about that?
I think that's generally, we're pretty cautious here, in our office, and we plan to kind of be that way. And our staff people, if our staff people are sick, they work from home.
Right.
If they're really sick, they're not working. Like, come on, your body needs some rest sometimes.
Yes.
Like,
Yeah.
I feel a little bit mixed about the whole, well, I'll just work from home. Like, if you're sick, you probably might need rest. How about don't work at all for a day? Like, heal up. But like if
That's a
we do
good thing.
have
That's a
illness,
good thing to say to a doctor, Julie. That is
right.
maybe I just do need to rest and stuff.
Eat an apple. So yeah, that's generally, we don't want sick people here for sure. And then especially with our clientele, but yeah, we have masks available. So if somebody comes in and they forgot theirs, because it's like sometimes you wear it, sometimes you don't. Of course, we're all going to forget them too. So we just have them around in our lobby. If someone forgets, we'll remind them and give them a mask, and it's all good.
Cool. Well, I do think that you guys are doing, it is a safe place for cancer patients. You have emailed me and contacted me trying to see sort of where things are. What are you guys doing? And I do feel as that you guys have done a good job and have provided great support. And I loved being at the Christmas party. That was wonderful to be around everyone with the Christmas masks.
It was, yes.
So I do.
We had Christmas masks, yes.
Yeah, those are so fun. I wore it for our holiday gathering. So I do feel like it is important, though. I cannot emphasize enough that it is important for patients to plug into survivorship services. That journey continues despite COVID and alongside COVID. So trying to plug in and figure out what to do with your life after cancer treatment is very, very important.
Yeah, okay. So that wraps us up. But if you want to talk more about this and share what you're doing, please come to our survivorship discussion group for this topic this month. So all of our videos, if you missed last month or you're looking for future ones, all of our videos will be posted on our website at cancerservicesonline.org/special topic. Audios on the Triad Cancer Connection podcast. We would love for you to come to our discussion group, either in person or virtual, on the 4th Tuesday. And you can register at cancerservicesonline.org/register. Let's see what else. I think that's it. So thank you all for joining us today. Dr. Wentworth, for all this fun and amazing information. And be sure to check out our website for upcoming events and information. And we hope to see you soon. Bye.